Did you know that 1 in 10 people worldwide lives with chronic kidney disease, yet most don't even realize it? Your kidneys are silently filtering 120 to 150 quarts of blood every single day, and when they start to fail, they do so quietly, often without any symptoms until it's almost too late. Welcome to today's deep dive into kidney health, where we'll explore the most effective strategies for preventing kidney disease and managing it if you're already affected. I'm here to share evidence-based insights that could literally save your life or the life of someone you love. The information we'll cover today comes directly from the latest clinical guidelines from organizations like the Kidney Disease Improving Global Outcomes, the CDC, and leading medical institutions worldwide. Let's start with a sobering reality. Chronic kidney disease is now recognized by the World Health Organization as one of the fastest-growing causes of death globally. But here's the empowering truth. Most cases of kidney disease are preventable, and even when it does occur, proper management can dramatically slow its progression and preserve your quality of life for decades. Your kidneys are remarkable organs that do far more than just filter waste. They regulate your blood pressure, produce red blood cells, maintain the delicate balance of minerals in your body, and even help keep your bones strong. When kidney function begins to decline, it affects every system in your body, which is why prevention is absolutely critical. The two leading causes of kidney disease are diabetes and high blood pressure, accounting for nearly 2/3 of all cases. According to recent data from the CDC, diabetes-related kidney disease affects people at 4 times the rate in certain populations, particularly African Americans. This isn't just about genetics. It's about understanding risk factors and taking proactive steps to address them. Let's talk about diabetes first. When your blood sugar levels remain elevated over time, they damage the tiny blood vessels in your kidneys called glomeruli. These are the filtering units that clean your blood, and once they're damaged, they can't be repaired. The good news is that excellent blood sugar control can prevent this damage entirely. The American Diabetes Association emphasizes that keeping your hemoglobin A1C below 7% dramatically reduces your risk of developing diabetic kidney disease. But what does excellent blood sugar control actually look like in practice? It means working closely with your healthcare team to find the right combination of medication, diet, and lifestyle changes. It means checking your blood sugar regularly, understanding how different foods affect your levels, and making gradual, sustainable changes to your eating habits. Studies published in leading nephrology journals show that people who maintain good blood sugar control for years can have kidney function that's virtually indistinguishable from people without diabetes. High blood pressure, or hypertension, is the other major culprit in kidney disease. The relationship between blood pressure and kidney health is particularly complex because high blood pressure both causes kidney disease and is caused by kidney disease. It's a vicious cycle, but one that can be broken with the right approach. The latest KDIGO guidelines, updated in 2024, recommend keeping blood pressure below 120/80 for most people with kidney disease. This is more aggressive than older recommendations, but the research shows that this lower target significantly slows the progression of kidney disease. The key is finding the right medications and lifestyle approaches that work for your individual situation. Effective blood pressure management isn't just about taking pills, though medication is often necessary. It's about reducing sodium intake to less than 2,300 milligrams per day, which is about 1 teaspoon of salt. It's about maintaining a healthy weight, staying physically active, managing stress, and limiting alcohol consumption. The DASH diet, which stands for Dietary Approaches to Stop Hypertension, has been shown in multiple clinical trials to lower blood pressure naturally and protect kidney function. Now let's discuss some of the less obvious risk factors that many people don't know about. Certain medications, particularly non-steroidal anti-inflammatory drugs like ibuprofen and naproxen, can damage your kidneys when used regularly over long periods. The CDC warns that these over-the-counter pain relievers are safe for occasional use, but chronic use can lead to what's called analgesic nephropathy. This doesn't mean you can never take these medications, but it does mean you should use them judiciously and always follow the dosing instructions on the package. If you find yourself reaching for pain relievers more than a few times a week, it's worth talking to your doctor about alternative approaches to managing your pain. Dehydration is another often overlooked risk factor. Your kidneys need adequate fluid to function properly, and chronic dehydration can lead to kidney stones, urinary tract infections, and even acute kidney injury. The old advice about drinking 8 glasses of water a day isn't necessarily right for everyone, but most people should aim for clear or light-colored urine as a sign of adequate hydration. Family history plays a significant role in kidney disease risk. If you have parents or siblings with kidney disease, your risk is substantially higher. This is partly due to genetic factors and partly due to shared environmental and lifestyle factors. Knowing your family history allows you and your healthcare provider to be more vigilant about screening and prevention. Certain ethnic groups, including African Americans, Hispanic Americans, Native Americans, and Asian Americans, have higher rates of kidney disease. This increased risk is due to a combination of genetic factors and higher rates of diabetes and high blood pressure in these populations. If you're from one of these groups, it's particularly important to stay on top of your kidney health screening. Age is another non-modifiable risk factor. Kidney function naturally declines with age, typically starting around age 40 and continuing throughout life. This normal aging process is different from disease, but it does mean that older adults need to be more careful about medications that can harm the kidneys and should have their kidney function monitored more regularly. Let's talk about the silent nature of kidney disease and why regular screening is so crucial. Early-stage kidney disease rarely causes symptoms. You might feel perfectly healthy while your kidney function is declining significantly. By the time symptoms appear, things like fatigue, swelling in your legs and feet, changes in urination, or nausea, you may have already lost 60 to 70% of your kidney function. This is why the National Kidney Foundation and other leading organizations recommend regular screening for people at risk. The screening process is simple and involves 2 basic tests: a blood test to measure creatinine levels, which is used to calculate your estimated glomerular filtration rate or eGFR, and a urine test to check for protein. Your eGFR tells you what percentage of normal kidney function you have. A normal eGFR is 90 or higher. If your eGFR is between 60 and 89, you may have mild kidney disease, especially if protein is found in your urine. An eGFR below 60 indicates moderate to severe kidney disease, and an eGFR below 15 means you have kidney failure and may need dialysis or a kidney transplant. The urine test looks for albumin, a type of protein that shouldn't be present in significant amounts in your urine if your kidneys are healthy. The presence of albumin in the urine, called albuminuria, is often the earliest sign of kidney damage and can occur years before your eGFR starts to decline. If you have diabetes, high blood pressure, heart disease, or a family history of kidney disease, you should have these tests done annually. If you're over 60 or have other risk factors, your doctor might recommend more frequent testing. The beauty of these tests is that they're inexpensive, widely available, and can catch kidney disease in its earliest stages when interventions are most effective. Prevention strategies go far beyond just managing diabetes and blood pressure. Though those remain the most important, maintaining a healthy weight is crucial because obesity increases your risk of diabetes, high blood pressure, and kidney disease. Even a modest weight loss of 5 to 10% can significantly improve your kidney health if you're overweight. Physical activity is one of the most powerful tools we have for preventing kidney disease. Regular exercise helps control blood sugar, lowers blood pressure, maintains healthy weight, and improves overall cardiovascular health. The latest research suggests that you don't need to run marathons. Even moderate activity like brisk walking for 30 minutes most days of the week can provide substantial benefits. Diet plays a huge role in kidney health. But the recommendations aren't as restrictive as many people think, especially in the early stages of kidney disease. The Mediterranean diet, rich in fruits, vegetables, whole grains, fish, and healthy fats like olive oil, has been shown to protect kidney function. This diet is naturally low in processed foods and sodium while being high in nutrients that support overall health. Smoking cessation is another critical prevention strategy. Smoking damages blood vessels throughout your body, including those in your kidneys. It also increases your risk of high blood pressure and accelerates the progression of existing kidney disease. The good news is that the kidneys have a remarkable capacity to heal, and quitting smoking can slow or even reverse some of the damage. Let's discuss what happens when kidney disease is detected early and how proper management can preserve your quality of life for many years. The 2024 KDIGO guidelines emphasize that chronic kidney disease should be viewed as a manageable condition, not a death sentence. With proper care, many people with kidney disease live full, active lives for decades. The first step in management is addressing the underlying causes. If you have diabetes, optimizing your blood sugar control becomes even more critical. If you have high blood pressure, achieving and maintaining target blood pressure levels is essential. This often requires a team approach involving your primary care doctor, possibly an endocrinologist if you have diabetes, and often a nephrologist who specializes in kidney disease. Medication management becomes more complex as kidney disease progresses because your kidneys are responsible for eliminating many drugs from your body. Some medications need to be adjusted for reduced kidney function, while others should be avoided entirely. This is why it's so important to make sure all of your healthcare providers know about your kidney disease and work together to coordinate your care. ACE inhibitors and ARB medications, which are commonly used to treat high blood pressure, have special benefits for people with kidney disease. These medications not only lower blood pressure but also reduce protein in the urine and slow the progression of kidney disease. Recent studies have shown that these medications can delay the need for dialysis by several years in many patients. Newer medications called SGLT2 inhibitors, originally developed for diabetes, have shown remarkable benefits for kidney health. These medications, which include drugs like empagliflozin and dapagliflozin, have been shown to slow kidney disease progression even in people without diabetes. The evidence for these medications is so strong that they're now recommended by KDIGO for most people with chronic kidney disease. Mineral and bone metabolism becomes increasingly important as kidney disease progresses. Your kidneys play a crucial role in maintaining the right balance of calcium, phosphorus, and vitamin D in your body. As kidney function declines, you may need to take special medications called phosphate binders and vitamin D supplements to prevent bone disease and other complications. Anemia is another common complication of kidney disease that can significantly impact your quality of life. Your kidneys produce a hormone called erythropoietin that stimulates the production of red blood cells. As kidney function declines, you may develop anemia, which causes fatigue, weakness, and shortness of breath. Fortunately, this can be effectively treated with medications that stimulate red blood cell production or iron supplements. Regular monitoring becomes increasingly important as kidney disease progresses. This typically involves blood tests every 3 to 6 months to check kidney function, mineral levels, and other important markers. Your healthcare team will also monitor your blood pressure closely and may recommend home blood pressure monitoring. The emotional and psychological aspects of kidney disease management are often overlooked but are incredibly important. Learning that you have a chronic condition can be overwhelming, and it's normal to experience feelings of anxiety, depression, or fear about the future. Many kidney centers have social workers, counselors, or support groups that can help you cope with these challenges. Diet modification becomes more important as kidney disease progresses. But it's not as restrictive as many people fear. In the early stages, the focus is on heart-healthy eating, controlling blood pressure, and managing diabetes if present. As kidney function declines further, you may need to limit protein, phosphorus, and potassium in your diet, but a skilled renal dietitian can help you navigate these changes while still enjoying delicious, satisfying meals. One of the most important things to understand about kidney disease is that progression isn't inevitable. Many people with early-stage kidney disease never progress to more advanced stages if they receive appropriate care and follow their treatment plans. Even when kidney disease does progress, it often does so very slowly, giving you years or even decades of good quality life. Planning for the future is an important part of kidney disease management, even in the early stages. This doesn't mean assuming the worst, but rather being informed about your options so you can make the best decisions for your situation. If kidney function does decline significantly, there are excellent treatment options available, including different types of dialysis and kidney transplantation. Dialysis technology has improved dramatically over the past few decades. Home dialysis options allow many people to maintain their independence and quality of life while receiving life-sustaining treatment. Kidney transplantation outcomes have also improved significantly, with many transplant recipients living normal lifespans with excellent quality of life. The research pipeline for kidney disease is incredibly promising. Scientists are working on artificial kidneys, regenerative therapies, and new medications that could potentially reverse kidney damage. While these treatments aren't available yet, they offer hope for even better outcomes in the future. Prevention remains our most powerful tool against kidney disease. The strategies we've discussed today, controlling blood sugar and blood pressure, maintaining a healthy weight, staying active, avoiding harmful substances, and getting regular screening, can prevent most cases of kidney disease. Even if you already have kidney disease, these same strategies can slow or stop its progression. The key message I want you to take away today is that kidney health is largely within your control. Yes, there are risk factors you can't change like your age, family history, or ethnicity, but the modifiable risk factors are the most important ones. The choices you make every day about what you eat, how active you are, whether you take your medications, and how well you manage other health conditions have a profound impact on your kidney health. If you're at risk for kidney disease, don't wait for symptoms to appear. Talk to your healthcare provider about screening tests and develop a prevention plan tailored to your individual risk factors. If you've already been diagnosed with kidney disease, know that with proper management, you can live a full, active life for many years to come. The treatments available today are more effective than ever. And the research continues to bring us new and better options. Remember that managing kidney disease is a team effort involving you, your healthcare providers, and often your family members. Stay informed. Stay engaged in your care, and don't hesitate to ask questions or seek support when you need it. Your kidneys have been working tirelessly for you your entire life. Now it's time to return the favor by taking the best possible care of them. Thank you for spending this time learning about kidney health. The knowledge you've gained today could make a real difference in your life or the life of someone you care about. Take care of your kidneys, and they'll take care of you.